21 News.
All right, parents out there, this is a constant issue, ear infections. If you have kids, well, then you know all about it. Almost half of kids will have an ear infection by the time they are 1 year old. Treatments range from medication, some get surgery or tubes. So for some parents, the alternative solution could be a chiropractor. Joining us in studio, Dr. Jacob Fletcher with Wellbeing's Chiropractic. Good to have you.
Thank you very much.
As always, and we have Addie and Dad.
We do.
Addie, who actually came to Dr. Fletcher for this exact issue. So first of all, there's going to be a lot of skeptics out there, right?
Absolutely.
People are going to say, wait a second, a chiropractor can fix ear infections. How does this work?
Well, and you know, the results are the most important part. And when we look, as a chiropractor, what we look for in the spine, and specifically to ear infections, it's the upper part of the spine.
Okay.
When that misaligns, it's what we call a subluxation. That subluxation can affect the nerves. It can also affect the muscles and cause tension in the muscles. And when we look at the upper part of the neck,
okay,
when there's tension in the muscles, things aren't draining. Things back up in the ear. That's where we often get the ear infections.
It's all connected.
Absolutely, it's connected.
And what was Addie dealing with?
Addie had about 4 consecutive rounds of antibiotics, at which point we'd gone to see an ENT. We were getting ready to do a minor surgery to install tubes to deal with this. And right in that final stretch there, our doctor had recommended we go and see Dr. Jacob. And I think we had a lot of success. We have not had an ear infection since. We had avoided the tubes. And so, you know, it seemed to work for us.
Were you skeptical at first?
I was a little skeptical, but, you know, talking to Dr. Jacob, talking to our pediatrician,
yeah,
it made sense, right? And so we gave it a shot.
Well, it's worth it.
I think the results proved out well.
I mean, it's one of those things you might as well try it before you do the extreme measure of getting tubes.
Which is what we were trying to avoid.
Exactly right.
So.
And a lot of people would say too, I mean, because my first question is, wait a second, I mean, how does a 2-year-old have misaligned bones in their body? They're so young.
Sure. Well, it can be the birth process, and it can also be you've got kids, you've got a 2-year-old, you've seen how many times they fall by the time they're age 2.
What are you saying about my parenting skills, doctor? No, you're right. I mean, they're just constantly tumbling all over the place.
Right, and so that's where those misalignments often come from. And so as chiropractors, one thing to know is you know, specific pediatric trained chiropractors, it's not the normal type of adjusting. So it's the pressure that we use is like the pressure that you would use on a ripe tomato. So it's very gentle, it's very specific.
Interesting, and that's different obviously from when you adjust an adult.
Correct.
And so are there ear issues for adults too that you treat as well?
Yeah, I mean, we do have a lot of
probably
times
less likely
because of how it changes over time and the orientation. But I have adults that have come in that are still getting ear infections, and as they're under care, things change because stuff is draining properly.
And if parents aren't quite sure, I mean, would you suggest, hey, it's worth it to check it out?
Yeah, because parents are really looking for alternatives to those multiple rounds of antibiotics and going under anesthesia.
For sure. Well, thank you, doctor.
Absolutely.
Good to have you. Thank you, guys. Addie.
Thank you.
I'll shake your hand, but Addie, can you give me Nux? Nice job. She is cute as a button. Thank you guys for coming in. All right, let's get